good morning, good afternoon, and good evening, wherever you may be viewing and listening to this in the world. You're very welcome to this webinar looking at gout, which, as we know, is one of the most painful and yet also one of the most manageable of long-term conditions, especially from the rheumatic and musculoskeletal disease family. This webinar is designed to support activities around Global Gout Awareness Day, which is taking place on Monday, the 22nd of May. We're going live, as those of you already here know, today, May the 18th. And this webinar is brought to you by the Global Alliance for Patient Access, GAFPA. My name is Neil Bettridge. I'm the director of the European Alliance for Patient Access, which, as you can probably figure out, is the European division of GAFPA. But this is a truly global event. We have participants from all over the world, and activities on Monday are going to be truly global in nature. We are going to be covering a wide range of issues today. It's going to be holistic in nature by presenting not only the clinician perspective on gout, and there'll be some of that, but also very importantly, perhaps most importantly, the patient perspective too. So let's have a look at the agenda and see what we're going to be covering. So in a few moments, I'll introduce or identify our three distinguished speakers. Just say a few words about the work of GAFPA, for those of you who don't know us well. Then we'll have our presentations where Professor Tony Woolf will give us a clinician perspective on gout, so largely educational, but also pointing us towards some of the positive options that exist around gout now. And then we'll be switching over to Gary Ho from the US, who's going to give us a patient view on living with gout. Then after a short video, myself and Professor Dr. Arturo Loaiza-Bonilla will be discussing stigma, which sadly, as many of you will be aware, often attaches to living with and sometimes treating gout too. There will be some time at the end, we hope, for questions and answers, your questions. So please feel free to leave your questions in the Q&A function. So that should be on your screen, probably just next to the chat. So please use the Q&A function for that. We'll get through as many as we can. We can't, of course, treat questions based on individual cases. That's always best done with your individual doctor, but all other aspects of gout, we'd be happy to hear your comments and or questions. And if we can't get through them all today, we'll try to get back to you afterwards over email. So I think that's the scope of it. If we move on to have a look at the speakers who are going to be with us today. We're going to be hearing shortly from Professor Tony Woolf, who's a rheumatologist based in the UK, from Gary Ho, as I mentioned, is a patient advocate from the US, and then also Arturo, who's president of the board of GAFPA. And then before we get going on that, just a very quick one slide from me about GAFPA, just so that you understand who it is that's presenting this, although we're doing this in conjunction with a range of other partners who will identify it towards the end of this webinar. And for those who don't know, GAFPA it's an international, well-established, non-profit organization whose ethos is really about promoting the benefits of patient-centered care. And by that, we mean the opposite, really, of disease-centered care. So everybody is unique. Everybody has a whole range of issues that need to be taken into consideration during their treatment. And through a process of shared decision-making, we believe that individualized care is always going to be better for the individual and also for the healthcare system. And our way of working is that we engage with a wide range of stakeholders to try to advance policies that enable patients to get access to the right treatment for them at the right time. And for us, when we talk about stakeholders, we're really talking about patient groups, individual patients, medical societies, clinicians, and many other groups. So to do this, we bring these stakeholders together in a range of settings, both in person and online, like today, often around the table to discuss policy issues of common interest, but also provide training on raising awareness and advocacy. And the way we develop the work beyond that is to develop materials which we hope will support people who are the experts in the field, whether it's a particular disease or a particular health policy issue, by producing white papers, policy briefings, a range of social media content, videos, blogs, and webinars and podcasts like today, because we are not the experts in any one disease. Our expertise is really about supporting stakeholders who are the experts. That is patients, patient groups, clinicians, and so on. So we are generalist in nature, but hope we can bring something to the party in terms of education, policy issues, and advocacy. So I hope that provides the context for this 1 hour webinar. And if everyone's okay with that, we will move on to our first speaker. And it's my pleasure to introduce Professor Anthony Woolf, who is based in Cornwall, out of the Royal Cornwall Hospital in the UK. And as I know from many years of working alongside Tony in different settings, Tony's done an enormous amount to empower patients, not only in clinics, but actually at the policy level, at national, regional, and global level, and indeed is currently still the co-chair of the Global Alliance for Musculoskeletal Health. But today and right now, Tony, we'd love to hear your presentation looking at the clinical aspects of gout. Thank you for joining us.
Okay, so thank you very much for giving me this opportunity. And just to confirm that you can see my slides.
Yes, thank you, Tony. Great.
So I'm going to give a clinical perspective of gout. And key thing, as many of you are aware, that gout is a disabling and common disease across the world, particularly in Europe, with a prevalence of affecting between 1 and 2 people per 100 depending on the country. And it's increasing steadily, particularly in some countries such as the UK. And this is despite there being effective treatments. There's still a lot of misdiagnosis and not perfect management. So much can be done to still improve things. So when we're describing gout, there's 3 concepts to get across. Gout itself is a disease resulting from the deposition of crystals of monosodium urate in the tissues which trigger off inflammation. These are made from uric acid, and that's the byproduct of the breakdown of proteins, what's called purines. And many people have high levels of this in the blood, which sometimes comes out as crystals, sometimes not. And the reason why people can have too much uric acid in the blood is because either they're overproducing it or they're not excreting it enough. So it's quite common to have hyperuricemia, but not everyone gets the crystals and gets gout. And that's one of the things we need to try and understand better. So there's a journey that often happens of going from asymptomatic hyperuricemia, that's too much uric acid without causing any problems. And then some people will get acute flares of gout due to crystals being deposited. And then that become quite regular, frequent attacks and going into a more chronic disease process with joint damage. And that's the journey which can be followed unless we intervene effectively. It's an extremely painful condition, and this description 400 years ago really gets it across that the person often goes to bed, gets to sleep, and suddenly wakes up with the most excruciating pain that it cannot bear the weight of any clothes upon it. Most people describe it as one of the most painful conditions that they've ever experienced, similar to a broken bone, if not worse. And as a clinician, if I was suspicious that someone was describing an attack of gout, I would say, what would be your reaction if I went to grab your big toe when it was inflamed? And they would just look at me aghast and threaten that they would rather thump me on the nose than let me grab hold of their big toe. And that, in a way, confirms it's gout, because nothing else really causes such severe acute pain and tenderness. Coming on suddenly and curiously self-limiting the acute attack, although they can come back again. Typical sites of getting gout are the elbows, the bursa, the electron bursa, the knee, the ankle, the toes, the big toe in particular is one of the classic joints you see in various images of gout. This is in the electron bursa, that's a fluid-filled sac protecting the elbow. When you lean on your elbows, it stops pressures on the joint itself and on the bones, but can become inflamed by gout. Then, as I said, people can go on to developing involvement of many joints, polyarticular involvement, intermittent attacks gradually becoming more regular, and some persistent inflammatory problems. And in days gone by, 100 years ago, it could end up at a stage where it looked very much like end stage, severe rheumatoid arthritis with a lot of joint damage. Also, an interesting fact is that if you do a blood test during an acute flare, sometimes the uric acid actually can be normal. So a blood test showing a normal uric acid during a flare doesn't exclude it being gout. As I said, it can become chronic, and that's particularly if the high uric acid in the blood is not controlled at all. You get more deposits in the tissues throughout the body, in the kidneys, around the joints, and you can get this chronic stage with joint damage. Various factors seem to trigger off acute flares, such as trauma, alcohol, overeating, dehydration or fasting, sometimes illnesses, acute illnesses that might also be associated with some dehydration. They can affect the levels of uric acid and trigger off an attack. As I said, you can get joint damage, and this picture, this X-ray, shows how you can get some erosions of the joints, which are not reversible. So that's why you have to get in early before that stage happens to people. And again, this shows that you can get significant deposits of uric acid in the joints, causing damage. You also get collections of uric acid in the soft tissues called tophi, and these occur typically in the ear, the elbow, along the border of the forearm, and in the tendon at the heel, the Achilles tendon. And this is what they look like. You can sort of see white coming through just below the skin with overlying redness as well. And that's a typical tophus. Also, these little white lumps of crystal in the finger here are tophi. And again, on the knuckle here, you can see a tophus. And this is a classical thing you see in the ear. It's one of the classic sites you look for. So that is what it is. And it's common. It's not rare. You can see that it is something which affects men more than women, and also the frequency increases with age. As I mentioned, there is an association with the uric acid, and as the uric acid goes up, you see more frequent episodes of gout. Where you end up with hyperuricemia, as I mentioned at the beginning, is two reasons. Either you're producing too much, or you're not getting rid of it, you're under-excreting. And that allows it to build up and cause gout, get deposited in the tissues, affect the kidneys, and there are other illnesses associated with gout as well. When it comes to the risk, there is a strong familial tendency of gout. Some drugs can cause it. Diuretics can affect the excretion of uric acid. Low-dose aspirin can as well. And also high alcohol intake and being overweight are also associated with gout, as well as eating a diet with a lot of meat and seafood in it, although nowadays it's not so usual for people to get to that level of protein in their diet. This shows an association with alcohol, and it's been long known that alcohol and people who have a high regular intake of alcohol are more at risk of getting gout. There are some other disease associations of having gout. You can get renal disease, a direct effect of the gout, because of crystals being deposited in the kidney and causing stones, blocking the urethra and the ureter, where urine gets passed along. But there's also associations with obesity, metabolic syndrome, diabetes, hyperlipidemia, and heart disease. So we know that if someone has gout, we should screen them for these other conditions, because they may need interventions also for their heart disease, or you might find something for diabetes. When it comes to making a diagnosis, as I said, the serum urate may be normal at the time of attack, and also it may be elevated in someone with joint symptoms for another reason. So yes, it is useful to know the serum urate, and we monitor it when we're treating people, but it's not always diagnostic. The history, as I said, is typical of the severity of the pain and the tenderness described, but the gold standard is looking at the synovial fluid and seeing crystals of gout in white blood cells, and that's very important. The main thing you need to exclude is infection, because that's something you don't want to miss, but there's other reasons why people can get an acute, hot, painful joint that have to be considered. So polarizing microscope examination of synovial fluid to see crystals is the gold standard for making a diagnosis. Although obviously, if the joint is extremely painful, it's not an ideal time to stick a needle into it. So sometimes it has to be on a clinical basis. Some of the pitfalls in making the diagnosis is people presenting with several joints being inflamed, and the physician thinks, oh no, it can't be gout because that's typically just one joint. Also, as I've mentioned, the serum urates can be normal during an attack. So again, sometimes people do that blood test and say, oh no, it's not gout. When it comes to treatments, colchicine is very effective for gout, but other diseases can improve with that as well. So that isn't always diagnostic. We also think that women don't get gout, but postmenopausal women can get gout, particularly if they're on diuretics. And so gender is not a reason to exclude gout. And also there can be not the typical joints involved in gout. So one has to keep an open mind when trying to make a diagnosis from a clinician's point of view. Once diagnosed, then the aim of treatment is to terminate the acute flare as quickly as possible and protect against further attacks, prophylaxis. So when it comes to treatments, the key principles in the EULAR recommendations at the European League of Associations for Rheumatology is that every person, quite appropriately, should be fully informed about the disease and the treatment options so they can make an informed decision. They should receive lifestyle advice about how they can help manage it themselves, and also they should be screened for comorbidities, particularly cardiovascular disease. There's also a pathway of how clinicians should manage gout, and I'm not going to go through it in detail, but the most important message is that acute flares of gout should be treated as early as possible, and patients should be enabled to self-medicate at the first warning symptoms. They normally recognize that twinge in the big toe that's going to become an attack of gout, and so the sooner they take an anti-inflammatory, if that's appropriate for them, or colchicine, the better to abort the attack. Then there are recommendations of how to manage in the longer term to prevent further attacks. And this is principally through what we call urate lowering therapy, ULT. And this should be considered and discussed when the diagnosis is made at the first presentation. And it's indicated if people are getting recurrent flares, have tophi or trouble with their kidneys or renal stones, which indicates that they have large deposits of uric acid, urate in their bodies, which needs to be got rid of. If someone's just had one attack, they are not usually ready to agree to take a treatment, which they need to take every day for many years. So it's a decision about when to start it, because as I said, once started, it's a long-term therapy. Also, as you start mobilizing the uric acid to get rid of it out of the body, there is more risk of acute attacks happening. So usually during the first 6 months of treatment with a urate lowering therapy, you recommend the person takes colchicine or an anti-inflammatory in a low dose to try and prevent the mobilized uric acid triggering off an attack. And you should monitor the levels of uric acid to check or getting there and reducing them and getting rid of the tophi. So allopurinol is the standard recommendation for people with normal kidney function. But if that doesn't work, or if there are various contraindications, then there are now other options such as febuxostat, and then one can use pegloticase as well as another option. But the most important thing is to find an effective way of reducing the urate and for the person to continue to take it in the long term. And this just shows the dramatic improvements which can happen if you reduce the urate. This is a finger with a tophus. It's ulcerated through the skin. It looks horrible. And you might think, is that person going to sadly lose their finger because it is so badly affected? But you can see how it has healed very well by lowering the uric acid and dissolving that tophus. So, in conclusion, there's some key challenges to consider. One is when to start urate lowering therapy, and that conversation and making that decision. Then it's about adhering to the urate lowering therapy, because if people take it intermittently or stop, then the uric acid will accumulate again and they'll start getting attacks of gout again. And then it can become very confusing as to how to treat it, because the person starts thinking that the drug for their gout is giving them gout. So getting full understanding and shared decision-making is very crucial to the effective management of gout. And there are also various contraindications to some of the drugs, particularly if people have other diseases like renal failure or heart disease, which means you have to tailor the treatment for that individual. So it's when to start, good shared decision-making to ensure there is good adherence, otherwise it can become troublesome and actually trigger off attacks, and also checking whether there's any contraindications and tailoring the therapy to be appropriate for that individual. Thank you.
Well, thank you very much indeed, Tony. It's so important that we understand what gout is, what causes it, how it manifests. So thank you so much for telling us that in such clear, accessible language. Only with that in our minds can we really think, I think, about what treatment options should be right for which individuals. So that's very empowering to have that presented so accessibly. Thank you. So just to remind everyone, there will be time for some questions at the end of the webinar, and please use the Q&A function to do that, and we'll be monitoring that throughout. So alongside the clinician perspective, it is, of course, just as important, if not more, to hear the patient perspective. And who better than Gary Ho to do this with us today. Gary is a patient advocate who's done so much to educate and empower the lives of other people in the US and beyond. As senior director at the Trend community and co-founder of the Gout Support Group of America, as well as doing a lot of other work in rare diseases and supporting people from underserved communities. So Gary, we're delighted to have you with us here today, and the virtual floor is yours.
Thank you so much. Thank you for having me. I am so excited to be here. Anytime I get an opportunity to speak about gout and to partner up with our healthcare partners, I get over the moon excited. So today, I would like to share my journey with everybody. And I'm hoping that my story and my experience can help other people that live with gout. So I want to start by asking a question. When you think of the number 16, what comes to mind? For myself, when I think of 16, I think getting your first driver's license. Most people will think driver's license, independence, maybe going on their first date, maybe experiencing their first kiss. Things that would bring warmth and joy to the soul, right? To make you smile. For me personally, when I think of 16, it actually is a number that brings, it reminds me of a dark period in my life. In fact, 16 represents the number of years it took me from my first gout flare to receiving a diagnosis. And so we're going to talk a little bit more about that journey in a little bit. But let me start the story by saying my first gout experience was actually in 1994. I was at the ripe age of 24 years old. You can see a picture of me right here. I was walking across campus, and out of nowhere, my ankle started to hurt a tad bit. And as the day progressed, it became worse. The pain gradually became stronger. And that night, it was completely inflamed and throbbing. It felt like a severe sprain or a broken bone of some sort. So I immediately called my dad up and I said, "Hey, Dad, I don't know what happened. I was just walking across campus and this pain suddenly came on." And he said, "Gary, you should probably go see a doctor. I have a condition called gout, and you might have it. I believe it runs in the family. So go ahead and make an appointment with a doctor," which I did. I typically will listen to my dad. I made the appointment. I went into my primary care physician. I still vividly remember sitting in his office, and I said, "Hey, doctor, something is happening with my ankle. I don't know what it is." And I explained to him that I was walking across campus, and I told him that I think I have gout in my family. So maybe I have gout. I remember him looking at me, and he smiled and he said, "Young man, you are way too young to have gout. It's not gout. You probably was, you tripped. Maybe you don't remember tripping. You must have done something, but I can assure you it's not gout." My first reaction was, yes, right? I was so happy to hear that a healthcare professional was telling me that I did not have gout. So I went home, I said, "Dad, I don't have gout. The doctor told me so," right? So I was so over the moon happy about that. So for the next 16 years, gout became increasingly more pronounced in my life. The gout pains, the gout flares became more frequent. And so let's go to the next slide and I'll continue the story. So you can see, this is basically, I call this the 16 years in the wilderness experience for myself. During the next 16 years, I was trying to manage the pain that would come on every now and then. And when it would come on, at first, it wasn't that bad. It felt like a mild sprain. But as time went on, it progressively got worse. And every time an attack would come on, I would go to the doctor and I would say it could be gout. And every single time they would just dismiss it and say it's not gout. Go ahead and just take some pain medication, it'll go away. Sure enough, with gout, it's kind of amazing, this disease. The average person living with gout would think, I only have gout when the pain comes on. What we don't understand and realize is that gout doesn't sleep, it doesn't stop. When you actually have gout, it's 24/7. You have a lifelong condition. Even when the pain is not throbbing on you, it's still actively producing crystals, the uric acid crystals around your soft tissues and joints that causes the pain. So it's a very progressive disease. And during the 16 years, my disease became progressively worse, to the point where in 2010, so I want to point out that I started in 1994 at the age of 24. I lost all of my late 20s. I woke up one morning and I was now 40 years old in 2010. And these two pictures these are a couple pictures that will show you what my life was like during the 16 years. You can see the top right picture. Because I was undiagnosed, the only thing that I could do to manage gout was basically to look towards home remedies. My mom would used to tell me, hey, eat a lot of yams, eat oranges, citrus would help, things of that nature. I would go and buy pain medication over the counter. When it got really bad and I'm using crutches now and I'm in a wheelchair, I would go to the ER. And every single time I would go to visit a medical facility, they would always treat the symptoms of gout. And over the 16 years, I was using pain management techniques and medication more so than I needed. And you can see from my face, that's from years of using steroids to control the flare and to control the pain. In 2010, I woke up and I hit rock bottom. And I was miserable. I felt lost. I felt alone. I felt so depressed. And I remember thinking, I need to do something to change the situation because I cannot live like this anymore. I just can't do it. I Google up gout. I looked up what that disease was. I found out that rheumatologists are the doctors that specialize with this disease. And at the time, my insurance company allowed me to pick the doctor. I was no longer had to depend on a general practitioner referring me to a rheumatologist, which they just, for whatever reason, didn't want to do. So I was able to pick a rheumatologist. I was living in Austin, Texas, in America at the time, and I found Dr. Christopher Parker. I remember going into his office and sitting down, and I told him, hey, doc, I'm going to tell you my journey for the last 16 years. I think I have gout and I am miserable. I cannot continue living the way that I am. Would you be able to help me? I spent about 10 to 15 minutes telling him my journey. And I remember him listening with compassion and with empathy. He didn't dismiss my pain. He took it all in. And then he looked at me and he says, Gary, it sounds to me like you have gout and you've been living with gout for the last 16 years, unmanaged. And there's a couple tests that we can do to diagnose the problem. The first thing I would like to do is to complete a blood test for you. I want to see where your uric acid level is. And then we can also stick a needle in you and pull out your blood to look under a microscope to see if we can find any uric acid crystal. And so we did that simple blood test, and immediately when the results came back, we saw that my uric acid level was north of 10 milligrams per deciliter. That was very high. I had signs of tophi throughout my body. In my elbow, my toe had a knot a size of a golf ball. And I remember just being, relieved, finally being diagnosed with gout, but just really in pain. Let's go to the next slide. And you're going to see, and this slide here is the journey of my recovery. So now that I'm diagnosed with Christopher Parker, we developed a management program for me. He explained to me that gout is a lifelong condition. He encouraged me to embrace gout and to learn everything I could about gout, which I did. I embraced the disease, and I decided to learn everything I could about this disease. And because my condition was so severe, when they diagnosed me, I was diagnosed with chronic gout. My condition was so bad that as I was taking maintenance medication, allopurinol and Uloric, which is a form of febulistat, my levels decreased, but it did not decrease enough. And at the time in 2010, there was a new infusion medication that was in phase 3 of clinical trials. And I remember Chris looking at me and saying, hey, Gary, you might be a candidate for this treatment. It's a treatment that infuses this medication into your blood, and it will immediately drop your uric acid level, hopefully to undetectable levels. That way your body can start the healing process. And I remember feeling a sense of hope. And I wanted to control that hope because I've been disappointed many times in the past. And you can see the bottom left picture is me coming into Chris Parker's office, and that's in 2010. That's when I hit rock bottom. You can see on my face, I am completely miserable. I just wanted to give up on life. My mental health stat at that point was just not good. The upper left picture, you can see that's my first infusion of the medication. And I was so excited to receive that. The infusion process was long. It was 6 hours per treatment, twice a month for 9 months. So it required a high level of commitment. But I was thinking, you know, I lived 16 years with unmanaged gout. It took everything from me. So I'm going to do everything I can to embrace the hope that one day I can live pain-free and get back quality of life. So after 9 months, my body started to dissolve all the uric acid crystals that were built up in my body. And you can see that I started to regain my health, regain my confidence, regain my quality of life. And the two pictures on the right really showcases that. In 2015, after living at the time about 5 years pain-free, I was reflecting with Chris, and I said, Chris, during the time of living with an unmanaged gout, it would have been so great for me to have a support group. Is there a support group for the gout, you know, this gout disease? He says, no. And I immediately said, Chris, we need to start a gout support group. And we did. We started our Gout Support Group of America in 2015. In 2021, we became a nonprofit. At this point right now, we're about 15,000 members on Facebook. We're a private group. Our mission is to really offer hope for people living with gout. We want to support their journey with gout, and we want to be able to empower them to seek diagnosis for themselves. And beyond that, I've been able to join a fabulous company called Trend Community. Trend Community is a data analytical company that uses AI technology to be able to harness anecdotal conversations that happen on social media and turn that into actionable steps for our healthcare partners. And the reason why I'm so excited about that is I am all about the voice of patients living with rare disease in the underserved community. If we can somehow harness that conversation and the communication that happens day in, day out on a grassroots level and hand that over to our healthcare partners and say, please listen to what we have to say. What we have to say matters. We know a lot about our condition. And here it is. Please take this into consideration as you're looking at new therapies for our disease. And so I am thrilled to be able to continue the work that I've been doing. You know, I encourage people that are living with gout. If you are living with gout, there is hope. People, we can have quality of life, and there is an opportunity to be pain-free while living with gout. I appreciate the time.
Gary, thank you so much. What a powerful account. And whilst, you know, so awful that you had to spend those 16 years in the wilderness, so inspiring how you did really, and what you've done since. So thank you so much. That was tremendous. Right, well, we're going to move on now to a short video. And again, remember, Gary, as with Professor Woolf, has kindly agreed to stay on to take questions at the end within the next 20 minutes. But for now, we're just going to have a short video produced by one of our partners for this initiative, the Alliance for Gout Awareness. And it, I think, builds on and complements some of the issues Gary has just raised, actually. So let's just take a look at this, then I'll talk to Arturo.
More than 9
I was in the Army when the gout first started. I needed 2 different size boots. A couple years later, the attacks got really bad. My wife drove me to the doctor's office, but I couldn't even walk. She had to carry me in the snow.
I was traveling for work, and I woke up in my hotel room in the most intense pain. I couldn't move. I lay there in the fetal position, whimpering. When I called the doctor, he told me, "You have gout."
Gout to me? It feels like sticking a fork in your ankle and trying to walk on it.
There's a stigma.
I've heard it called the King's disease.
People think you ate yourself into pain.
So I tried going vegetarian, taking turmeric, ginger.
Low carb, lots of leafy vegetables.
Turkey and chicken, turkey and chicken.
Getting to a healthcare provider helped. I went to a nephrologist.
A podiatrist.
A rheumatology nurse practitioner.
I was prescribed allopurinol.
Colchicine.
I take my medicine every day.
I describe gout as debilitating.
Overwhelming.
Hell. What helps? Family makes a big difference.
A healthcare provider who cares and listens.
Finding reliable information about how to manage gout, that helps.
And a sense of humor. It's good to keep your sense of humor.
More than 9 million Americans live with gout. The Alliance for Gout Awareness honors their struggle, their stories, and their resilience. Learn more and find resources at goutalliance.org.
Thank you. So, yeah, ending the stigma. We've heard quite a bit about stigma already, and I'd just like to have a few words of discussion now with Arturo Loaiza-Bonilla. Arturo, as I mentioned earlier, is the president of the board of directors at GAFPA, but way beyond that also is a distinguished academic, medical oncologist, has worked in immunotherapy, worked on clinical trial design, digital health, and a whole range of other things, including patient advocacy. But Arturo, I know you have a particular connection with gout, and it would be great if you could share that with us, please.
Yeah, thank you so much, Neil, for the kind introduction, and thank you for everyone who's attending. This is a very important topic to discuss, and as you mentioned, it's very close to my heart and my health and my history as a physician. Interestingly enough, I am the first physician in my family, not the last one. There's some more now that follow me. But the reason why I wanted to become a physician was precisely because of my personal experience in my family with gout. My grandfather, who was a very important figure in my life, he suffered from gout for many years, and it was an excruciating thing for him because he was in the military, very stiff guy in terms of, not showing, weakness, always being the provider for the family. And I saw him struggle when he had to, go from one place to the other when he was going into those, gout flares. And as a kid, I was very puzzled. I was like, why is he suffering from this? Why is he seeking help to get him better? And he ended up, he was afraid of telling people that he had gout, that he, was doing the wrong things, or that he was doing something that was not appropriate or had a stigma. And he didn't seek medical care as he should appropriately. So what he did is he took a lot of, pain medication, including NSAIDs, and eventually that led to him suffering from, chronic kidney disease, and he required a transplant. So he was on dialysis for many years, and unfortunately passed away from complications related to that. So to me, that was a call to action. Is that I need to become a physician, so no one else in my family or my loved ones have to go through this situation where they're feeling, afraid to talk to their doctors or to anyone about their gout or about any condition, because diseases are things that we handle, and we shouldn't be afraid of talking to anyone about them. There shouldn't be a stigma or anything to be ashamed of. So that's just part of my story on that end as a physician. But it goes further. I happen to suffer from gout myself. So try to be as healthy as possible. I eat well. I turkey and chicken as well, and vegetables. But still, I have those flares, and sometimes I'm in clinic and I'm limping, and people say, "What's going on?" And it's like, well, I have gout, and I have no issues telling people now because it normalizes it, right? Even myself as a physician, showing them that there's nothing to be afraid of. We are dealing with this as well, and even though I'm doing myself to keep myself healthy, we cannot manage our things on our own. We need to be very cognizant on seeking care when the time is right.
Well, Arturo, thank you for sharing that. So sad to hear about the experience of your father and you and your whole family there, but also so inspiring to hear how you're channeling that so that maybe others avoid some of those pitfalls. I mean, the video we just saw, it highlighted a couple of the myths that can surround gout. And of course, as if, living with gout itself isn't debilitating enough, not just the physical pain, as Gary illustrated, but also, the impact on mental health and therefore, your whole life. If that isn't enough to deal with, there are also these damaging myths that surround it. Would you like to say a few words about your either personal and or professional experience of those and how they factor into living with gout?
Correct. And I think it comes down to, first common myths that folks have about gout. So first that, oh, you maybe be drinking a lot of beer, or you're just, eating too much red meat, you have to hold down. And as they used to call it, the king's disease, right? Because it meant to be people who ate a lot and they didn't have self-control. And that's not the case. I can tell you also, because that was in my family. So, gout can be familiar, as was discussed earlier as well in the scientific discussion. It can run in families. So in my case, my mom had it, my grandma had her, so everyone had it. So basically I was meant to have it as well. So those things that happen in reality. So the other myths that happen is, there's nothing to do. You just have to deal with diet and lose weight. Well, if I lose further weight, I don't know what I'm going to say. I may disappear from camera. So I'm my BMI and everything's very, healthy. And I exercise, and I still get occasional flares even when I keep my diet under control. So it's something that folks need to realize that with healthcare styles, it's helpful, but it's also you sometimes may need medication, and there's nothing wrong with that. You may sometimes use it prophylactic medications, which I'll coach you in that. If, for example, I'm going to a party and I'm going to drink a couple of, there's an event and I have to drink champagne. Okay, I'm not saying people need to drink champagne, but if it happens to be a toast, you shouldn't be afraid of at least, partake on that event if that's something that you want to pursue. And sometimes discuss with your doctor if there's a need for any, prophylactic intervention or checking, if there's anything else that needs to be done. And lastly, that when you have the gout attack, it's something that is going to solve, and you need to tell people to understand what's happening. I don't want people to just go and exert themselves just to, not showing that they have pain or that they're dealing with this, because the pain, I can tell personally, is excruciating. It's something that you cannot really handle unless, you are taking your appropriate rest and taking the right medications.
Sure, absolutely. So I think we've illustrated some of the negative impact of the gout through the pain and the mental health impact, mobility, independence, social stigma. But you've highlighted a few positive ways of living with and managing gout as well there, Arturo. So just to wrap up this short section, if you had to give advice at the general level to someone who's living with gout, whether that's tips or suggestions or encouragement, what would it be?
Well, first of all, gout is just something that you are living with, but not something that defines you as a person. It's something that can be managed. There's plenty of lifestyle changes and medications available. Some of them very affordable that can be used for this disease. Is the same as having gray hair. To me, is the same as having gout. So I live with it. I handle it, and don't be afraid of sharing when you're dealing with that situation, and be happy about it. So just say that shouldn't stop me from doing anything I'm doing. Just living with gout is not a feature of my life. It's just something that I know I have, just the same as my last name. So I can do something about it, which is having a positive attitude, share your experiences. I think these forums where it normalizes the fact that gout is a disease that is very common, and that you're not alone in this fight and against this disease, and awareness, it's key. So surround yourself with folks that understand what's going on, and inform them as well, so they can become part of this movement.
Fantastic. Absolutely. You may have gout, but it doesn't have you. Know your options, understand the disease, pursue your options, and yeah, absolutely, it's becoming more and more of a can-do disease. So thank you so much for sharing that, Arturo. And if you and Gary and Professor Woolf could also just stay with us. I see you've put your cameras back on. Thank you, because I think we've had a few questions coming in. I'm going to turn to my colleague Olivia Perry now from our global policy team. Olivia, I think you've been keeping an eye on questions coming in. Do we have a couple?
Yes, we do, actually. The first question we have is, what recommendations do people have for those who are struggling with the mental health and the stigma side of having gout?
Sure. Well, I think any of our three panelists could answer that, but I guess, Gary, you proactively raised that with us earlier. Would you like to develop what you said earlier to respond to that one, please?
Yeah, absolutely. Mental health, I think, is a real thing, especially for people living with rare diseases, underserved communities, people living with gout. One of the first things that I want to acknowledge is that if you have gout, I want you to know that you're not alone. In America, there's 9 million of us, and I don't know how many is overseas, but I'm sure, our numbers are strong and quite healthy. Secondly, it's not your fault. One of the big stigmas, and I love hearing our previous speaker, as he was talking, it really inspired me and it comforted me. I didn't do anything to be blessed by this disease, right? I own it now, just like the gray hair that he talked about, just like my lack of hair that I have. I own it, and I'm happy about it. And there's many of us out there. So I acknowledge that mental health is an issue when it comes to people that are not able to effectively manage their gout, proactively manage your gout. I want you to know that there's hope. I encourage you to find some type of support system. In the age that we live now, support system can be found online easily, right? Go check out the Gout Support Group of America. Would be happy to have you. We have people all around the world that are part. Normalize the disease. And also, ultimately, just know that if you have gout, you can have quality of life that is pain-free if you can manage this disease on a daily basis. That right there should give you a lot of comfort.
Sure. Thank you, Gary.
Thank you.
And on Monday, the 22nd, Gout Awareness Day, there'll be a whole avalanche of materials and resources and signposting going on to help people with gout find materials and ideas that might just help them, as you suggest. So that's the whole point, really. So thank you very much. Olivia, do we have one or two other questions? I think we've got a couple of minutes.
Yes, we do. Another question was, how important is seeking treatment early for patients?
Sure. Who'd like to take that? Tony, do you want to say anything about that?
Yeah.
Thank you.
Very important. I think, I think Arturo and Gary have described the severity of the pain. And that really should drive someone to see a health professional who hopefully will put 2 and 2 together and make a diagnosis, because really there is no other condition which causes such acute pain apart from a trauma, but even that is not usually so painful. So it really should trigger off people recognizing it and diagnosing it. And then it's a matter of, yes, giving the right treatment, the anti-inflammatory. The main problem sometimes is that there's a nervousness nowadays to use anti-inflammatories in high doses, which is what really is needed to hit an attack of gout on the head. And also colchicine is often considered a fairly old-fashioned drug and can upset the tummy and give people the runs, as we say. And so, again, that needs to be got right. But the message is absolutely seek help straight away. And also, if people get recurrent cases, then have that discussion about should they be taking something to prevent it happening. And I think, Gary gives a terrible story, a very sad story, terrible story. And that's really what should not be happening. As a room, almost throughout my career, there have been effective treatments for gout available. And it's really frustrating that it's not well managed in many cases. And that's something we've really got to change. And there's no reason for stigma, because there's many other chronic diseases which affect people, where people have to take regular treatments for a long term for, if they have high lipids or high blood pressure. I think it's unusual as a condition that sometimes it's relatively young people who first get it. And I think at that age, it can be very challenging to recognize you've got a long-term condition. But I think we need to try and move away from that. And again, just if I quickly add around the stigma, we have to get rid of this thing that is caused by diet and bad diet and unhealthy diets, because those diets, the really bad diets, are just not eaten these days. The sort of Henry VIII sort of image of eating a whole carcass of an animal in a feast just doesn't happen. So we need to move right away from that and very much talk about it being one of those unfortunate long-term conditions that people need to manage and not feel ashamed about and talking about, etc.
Sure, absolutely. Well said. Thank you, Tony. Olivia, I wanted to say a couple of words about Gout Awareness Day as we finish in a couple of minutes. Maybe we can take one more question.
Yes, I think we have one last question here, and it's just what advice would you give to patients who are starting out their journey with gout?
Right. Well, Arturo, is someone who can speak to this from a patient, carer, and professional perspective. I think I'll pass to you on this.
It's for me, it's all about, being aware of, all the things that are happening around gout. So having the support from folks like, all the panelists here, and knowing that this is an opportunity for me to learn what are the things that can be better for myself and for my patients and for others who are affected by gout. It's the key thing that I want to do. I don't know if I think everything we're saying here is so inspiring that I'm almost like, okay, this is a community that I found that actually understands me as a patient, as a physician, as a caregiver. No, I don't know what else to say on this, but I think it's a great opportunity that we're all coming together here.
Absolutely. Thank you. And the point of the Awareness Day, of course, and many people will perhaps be looking at this on Awareness Day, is to spread that awareness and knowledge beyond this immediate community much, much wider. So the day is happening on May the 22nd. You can get involved in a number of ways. The hashtag, as you can see there, I hope, is hashtag Global Gout Awareness. And if you go to the GAFPA website, gafpa.org/gout, you can find some of the materials there. We'll be doing a lot on various platforms in social media, so please retweet, please raise your voice. It's what people with gout want and need, and I would say deserve. So just to wrap up, I'd like to say a special thank you to our partners who've been involved in this initiative, and you can see them there. Range from individual national patient groups to medical societies. Particularly like to thank SOBI for the financial support to make this possible. So I hope that everyone who's participated so far, as I speak, has found this informative and interesting and helpful. We really need the activity to follow, though, because we've heard how severe the impact of gout can be, and yet we've also much more positively heard that it is a highly manageable condition if people take the right steps, learn and understand their options, and then pursue those options. So that, in one sense, is a good note on which to finish, I think. Thank you to all of our panelists, everyone involved in making this webinar possible. Please raise your voice on Monday if you haven't already. Thank you and goodbye.